Hello, and welcome. Today, we're diving deep into hepatitis D, a unique and often overlooked liver infection. This isn't your average hepatitis, it's a bit more complicated, and we're here to unravel it all for you. Hepatitis D, also known as delta hepatitis, is caused by the hepatitis D virus, or HDV. Now, here's the crucial part. HDV is a sneaky virus. It's incomplete and can't infect you on its own. It needs the hepatitis B virus, or HBV, to replicate and cause infection. So, you can only get hepatitis D if you already have hepatitis B, either a chronic infection or a co-infection where you get both viruses at the same time. Okay, let's break down the pathophysiology. Once inside a liver cell, with the help of HBV, HDV hijacks the cell's machinery to replicate. It uses HBV's surface proteins to coat itself, allowing it to spread and infect other liver cells. This co-infection triggers a more aggressive immune response than HBV alone. The body's attempt to fight off both viruses leads to significant inflammation and damage to the liver. This accelerated liver damage is what makes hepatitis D so dangerous. Hepatitis D's prevalence varies globally. It's more common in certain regions, such as the Mediterranean area, Eastern Europe, the Middle East, and parts of South America. Globally, it's estimated to affect around 5% of people with chronic hepatitis B. Risk factors include intravenous drug use, multiple sexual partners, and being born in or traveling to high-prevalence areas. Understanding the epidemiology helps us target prevention and screening efforts effectively. The signs and symptoms of hepatitis D can be quite variable. In some cases, especially with co-infection, people may experience a sudden onset of symptoms similar to acute hepatitis, like jaundice, a yellowing of the skin and eyes, fatigue, nausea, vomiting, abdominal pain, and dark urine. In those with chronic hepatitis B, hepatitis D infection can cause a sudden worsening of liver disease, leading to cirrhosis and liver failure more quickly than hepatitis B alone. Some individuals, however, may have very mild or no noticeable symptoms, making diagnosis challenging. Diagnosing hepatitis D involves a blood test. First, we look for antibodies against the hepatitis D virus, anti-HDV antibodies. If those are present, indicating past or present infection, a confirmatory test called an HDV RNA test is performed to detect the virus's genetic material. This confirms active hepatitis D infection and helps determine the viral load, which is the amount of virus in the blood. Liver function tests are also essential to assess the extent of liver damage. While there aren't distinct types of hepatitis D in the same way you might see with hepatitis C, there are different genotypes of the hepatitis D virus. These genotypes vary in their geographic distribution and may influence the severity of the disease. Genotype 1 is the most common worldwide. Understanding the specific genotype can sometimes provide additional information for managing the infection. Treatment for hepatitis D is challenging. Currently, the only FDA-approved treatment is bulevirtide, a medication that blocks the virus from entering liver cells. Interferon alpha is another medication that was used in the past, but it has significant side effects and is only effective in a small percentage of patients. Liver transplantation is an option for patients with end-stage liver disease due to hepatitis D. Research is ongoing to find more effective antiviral therapies that directly target the hepatitis D virus. Prevention is key, and the most effective way to prevent hepatitis D is through hepatitis B vaccination. Because HDV needs HBV to survive, preventing hepatitis B infection also prevents hepatitis D. Avoiding risk factors for hepatitis B, such as sharing needles for intravenous drug use and practicing safe sex, is also crucial. Screening individuals with chronic hepatitis B for hepatitis D is essential for early detection and management. The prognosis for hepatitis D can vary widely. It tends to accelerate the progression of liver disease in people already infected with hepatitis B, increasing the risk of cirrhosis, liver failure, and liver cancer. Early diagnosis and treatment are critical for improving outcomes. Recent research is focusing on developing new antiviral therapies that specifically target the hepatitis D virus and on understanding the complex interactions between HDV and HBV within the liver.